of us in this country, Black or white, we are carrying trauma in our bodies. Whether we want to admit it or not, trauma is happening to all of us. When two people are in a violent act, the victim and the perpetrator are both in a trauma experience. Both have been exposed to trauma.
You're listening to the Wisdom for Wellbeing podcast, the show that blends science and heart to bring you evidence-based tips and tricks for cultivating a healthy, wealthy, and meaningful life. Now, here's your host, therapist, yogi, and fellow full life balancer, Dr. Caitlin Harkis.
Hi there. Today on Wisdom for Wellbeing, I am joined by Dr. Emily Butler. A native of Mississippi, a licensed psychologist and food relationship strategist who has made it her mission to help women of color heal and thrive in the areas of trauma and diet recovery. Dr. Ebony is a visionary and teacher. She specializes in guiding women to develop skills that increase their effectiveness in interpersonal interactions, including communication and asking and getting what they want and need. Dr. Ebony is specifically interested in issues that impact marginalized communities, including minority women and LGBT persons. Given the extensive amount of attention placed on body size and dieting in our society, Dr. Ebony understands how these pressures can impact one's relationship with food and their bodies. Thus, Dr. Ebony is passionate about helping others recover from diet culture while also learning to shape their health in a more empowered manner. And in fact, empowerment is really one of the reasons why she created My Therapy Cards. My Therapy Cards are a number of different cards that might look something like a deck of affirmation cards, but they go much deeper than affirmations and self-care. They're actually tools that are designed to support self-exploration, grace, insight, and ultimately compassion with oneself. My Therapy Cards are actually the first self-exploration card deck, and they were created by a Black psychologist, Dr. Ebony, for other women of color. Dr. Ebony will describe why women really need the permission to be able to engage in this work, My Therapy Cards or therapy generally. And she also talks through how different stereotypes, the strong Black woman, or different languaging, for instance, use of the word brave, which I actually did during this episode, how that negatively impacts on Black women's well-being. Now, with all of this in mind, I would like to introduce you to our wonderful guest today, Dr. Ebony herself. Hello, Dr. Ebony. Thank you so much for coming on to Wisdom for Wellbeing. Welcome. I am just delighted to be here with you today.
And I'm super excited to be here too. Thank you so much for having me.
I was just talking to you before the show about how generous it is for you to make time to have this conversation with me and the Wisdom for Wellbeing listeners, because you have been flat out with the My Therapy Cards, which is what we're going to be talking about today. These incredible cards that offer a resource for listeners to, go through a process of self-exploration and healing. But before we get into that, would you mind just sharing a little bit about who you are and, the work that you do?
Absolutely. So kind of like, I'm from Mississippi, and I say that because sometimes I tie things back to my upbringing, and kind of like, especially in the food strategist stuff. So I'm a licensed psychologist in Texas. I'm in Austin right now. And my practice is centered around working with Black women and other people of color around trauma, and helping them learn how to recover and thrive and regain their power. And that goes as far as learning how to communicate and ask for what they want and need. And so I'm also a food relationship strategist, where I help people understand and recover from diet culture, and understand just how oppressive that is to Black people and other people of color, and ways that actually takes our power. And so I operate in those two worlds, as a therapist in the therapy world, and as a coach or strategist in the food relationship world. And my main population of focus is going to be people of color. So that's kind of like the things that I kind of have myself involved in these days.
Well, that's incredible. And it's really, interesting because there has been a lot of conversation recently around the trauma that, Black people and people of color have suffered. And it's an interesting link that it ties in with, the real trauma around food as well. And you mentioned Mississippi, that has a link to the work you do. How
Yeah.
does that link?
Well, because I grew up around food being one where we bonded, one where it was kind of an act of service to cook for people, to show gratitude, to show appreciation. It was something that we really valued. It was a way to show art, like a way to show kind of like how grateful I am for you, like those kinds of things. And Mississippi is one of those places that if you hear in the news, they talk about obesity rates, they talk about how unhealthy the state is, but what they don't take into account is just how culturally centered food is for us. And so when we talk about kind of being Black in this country and being people of color, part of our experience comes with the heavy connection that we have with food and the ways that diet culture in this country and world have been shaped in direct opposition of bodies that look like ours. And so when you're talking about Black people and being overweight, when we think about obesity epidemic, many times people of color are wearing the face of obesity. And so if we're thinking about diet culture completely strips us of any cultural connection that we have to food, all for the sake of being skinny or being thin and being good enough. And so all of that I also think is deeply rooted in racism and white supremacy. And that for a large part, I read this book by Sabrina Strings called Fearing the Black Body. And she tied the historical connection back to kind of the concept of dieting and ideal body image and how that was created by men to kind of have us kind of adopt this European standard of beauty and body size, and how that was in opposition of everything Black, everything about the Black body. And so the thinner you were, the more away, like distant you were from the Black body. And so we talk about all of these things in our relationship with food and how that impacts us, and then ways that we cope, and that sometimes involves food, and then the ways that we recover from trauma. Like all of these things are so interconnected that I don't think that we could talk about one without talking about the other. And I love to talk about where I'm from, because diet culture completely makes you feel horrible if you engage in cultural practices around food. And basically that is stripping away who I am if you take that away from me. Basically, again, making me shed the very essence of who I am. Do I have to create and make poor choices around food? No, but there's no room for even balance and choice when it comes to diet culture. And I want to be able to connect with food in ways that feel traditional and cultural and not feel ashamed about that.
That's a really interesting, connection. And it sounds like it's multifaceted, that there's many layers, and that people, might have an experience of one and go, oh, wow, like there's all of these levels to it.
Yeah.
Well, link to the book that you said was by Sabrina, Fearing the Black Body. What was that book?
Fearing the Black Body. Yeah.
Yeah, we'll put that in the show notes for any listeners that are interested.
Oh yeah. I wish she were on Instagram, but I don't think she is. But you can find her book on Amazon, but I think it does a really good job of talking about the historical context of the Black body in this country and the ways that European immigrants came over and kind of created this concept of racism, because that wasn't even a thing. Like race in class, it was really based on geographical regions and where you were from, and you were Irish and you were German. And then for power purposes, which is the system that we now have of white supremacy, it was like, okay, white and then Black. And then all of the people from Europe were considered white and then lumped together for power purposes. And then you have Black. And so this categorical creation of races is kind of how we have kind of gotten where we are today, basically.
And there's a couple of things that have flagged me there. So the European struggle for power, or, white supremacy essentially in action, lumping together white bodies. Also that's really where diet culture evolved, that became the standard of beauty. So it was taking away from, a Black person's, a person of color's experience in the world. And I wonder how this actually links to the My Therapy cards, because this is really a step forward in being able to see and appreciate oneself.
Well, actually, when you think about us, things being created in direct opposition of people who look like us in our bodies, that is rejection. We all know what rejection feels like and the amount of trauma that rejection causes us. So to just be in our bodies in this country is traumatizing. Like there's a deep history. Because when we talk about diet culture, we can't talk about diet culture without talking about racism. We can't talk about racism without talking about slavery. We can't talk about slavery without talking about trauma. And then we're talking about generational impacts and generational trauma. So most of us, well, all of us in this country, Black or white, we are carrying trauma in our bodies. Whether we want to admit it or not, trauma is happening to all of us. When two people are in a violent act, the victim and the perpetrator are both in a trauma experience. Both have been exposed to trauma, and that lives in your body. And if we're talking about the way that that's passed on generationally, that's an impact on me. And as I show up outside, like just going outside, the world rejects me as a Black body. And there are so many things that I have to do to prove myself in this world and in this country. So imagine the amount of stress that causes us. Imagine the amount of anxiety and depression and things that we hold in our bodies. So then we have to go into the creation of the mental health system. The mental health system, while I love it, also has not done its best by people of color to provide access to resources and to provide helpful information to help us to be well and help us to kind of be able to afford mental health care and that kind of thing. And so we're needing to find things to be able to take care of ourselves. And I mean, just a lot of the inhumane treatment that has happened with Black people in the mental health industry, Black people in the medical field, the mistrust that is there, feeling experimented on, feeling like authority figures are out to kind of plant things on you as science projects, that kind of thing. And so you're really apprehensive about seeking out services. So you have this very complex relationship with the fields of mental health. And if you have that, then what does that mean for your psyche? Who are you going to turn to for help with that if there's this huge stigma associated with it? You don't. You carry it, you bury it, and you just press on. And that lives in our bodies. And that is completely detrimental to us to be able to carry that around. And so when you talk about how does this tie to my therapy cards is a resource that was created out of a need that still exists in the mental health industry. And that's a lack of resources, cost barriers, geographical barriers, geographical limitations, those kinds of things. And so this is kind of how it's all connected. It's just, we're getting better, but we still have a large majority of Black people and people of color, marginalized groups struggling to access mental health care. And while we have people who talk about self-care and affirmations and that kind of thing, I really do believe that we need to be doing the deeper work, and what better ways to get that information across than to have somebody who's in the field doing the work provide you resources that are just like at your fingertips for you to be able to get to the core of some of those things that may be happening for you.
What's apparent to me in hearing you explain this, Ebony, is how knowledgeable and how much you've integrated the information and the experience in this field, like the lived experience with your intellectual and mental health experience as well, to be able to create the My Therapy cards for people who have had these, disempowering experiences. And as you said, might not have the resources, the proximity, the opportunity, and to get through that historic experience of being marginalized and targeted by mental health services.
Yeah, absolutely. Absolutely. And just being educated about what this looks like, and kind of doing it in a way that is not harmful, doing it in a way that is so calm and that is so conversational, and it meets us at the levels where we are, and it destigmatizes the word therapy by putting My Therapy cards in the title. I intentionally created mailing boxes that has My Therapy cards on them because we need to be talking about, therapy, and so that we're not treating it as like it's a bad word or something, but that we're working to reduce that stigma. So it was super intentional, and so I'm happy to hear you kind of talk about it in those ways too, because sometimes I can kind of forget it and just kind of live in the marketing world of things and making sure things are done and be task oriented versus kind of focusing on the intention that was put behind it when this all started.
Well, tell me about that process of starting it, and a little bit more when people are hearing My Therapy cards, what should they be envisioning?
Yeah, they should be envisioning first a deck of cards that's going to help them do some self-exploratory work, some insight work, some cards that you can actually use with yourself. You can use this with a partner. This is for everyday people, the everyday woman. And this is for everybody. It was just specifically created so that Black women can have a mental health resources for ourselves. without kind of it, we needed to be thrown into kind of like, oh, and Black women, and that kind of thing, but that we have something for us. And so when people hear my therapy cards, we should definitely be hearing the word resource. We should be hearing the word tool. We should be hearing self-exploration. We should be hearing grace. We should be hearing kind of like kind of insight on ways that I can become more compassionate with myself. And that's kind of where all of this was born. So as a person who does private practice, I recognized that there were a lot of people who were reaching out to me that actually I could not work with because A, I'm part-time private practice, and then B, because of my fees. So I don't accept insurance. And one of the reasons I don't accept insurance is a lot of the problems that I have with the insurance industry is that they force you to diagnose, even if nobody has any pathology that warrants the diagnosis. And I just don't like that because it's further asking me to pathologize people who look like me, even when there's nothing pathological going on. Also compensation for time and the amount of time that you're spending working with the client versus what you're compensated for. And just kind of the back and forth of dealing with them and them being the gatekeeper to whether or not somebody can get care. So I've elected not to accept insurance, but to do some things like pro bono or sliding fee services so that people can afford the therapy. But then I know I still have limited time and space for that as well. So I wanted to create something that addressed that barrier and that was cost effective for many people, especially in marginalized communities and people who can only access this type of work in questioning that you have to pay money for that you may not even have. So I wanted that to be cost effective. I also wanted access to be addressed. So even me, when I'm seeking to find my own therapist, it is very hard to find somebody, A, who has availability, B, who is willing to work with another psychologist or therapist, and then being some, just all of these things that you run into, you can get people to call you back. And so just a lot of and I know what to ask. And if I have this information, imagine how hard it is for people who don't to be able to access services. So I wanted to address the issue of access, and I wanted to address the issue of stigma. And I was like, how can I do that? I don't really know. And I got this bright idea. I was like, you know what? A part of that, I have to say this, that I wanted to go further than just affirmation and self-care cards. And so I have to make sure that I am clear about that because I could, these are out there and I think they're great and I think they all have their space. I wanted us to go deeper because I feel like as Black women, we are very complex and we present with a unique set of issues because of all of our intersectionalities. And I think one of the things that we're bogged down with is that stereotype of being the strong Black woman and that we're having to take care of everybody else but not taking care of ourselves. I feel like self-care has a place there, but I feel like many times self-care is real pink and fluffy. I feel like affirmations are there, and I feel like sometimes affirmations are kind of sometimes fluffy. And I wanted us to understand that doing our hard work, we don't have to apologize for that. Doing the hard work in self-care is sometimes ugly, sometimes it's difficult, sometimes it's hard, and that we can do hard things when it comes to us. Because we know we can do hard things, but oftentimes it's in the context of other people. Like I know I can protect them, but we need to know that we can do the same for ourselves. So these questions were tailored in a way to help you get to the core of those things and kind of give yourself permission to do your own work and to give you a voice when we're so used to speaking up for other people, doing other people's work, kind of making sure everybody else is okay. But taking the time to do that for ourselves and doing it in a way that actually got at, kind of elevated us in a way further than what self-care and affirmation cards would do.
That's incredible. And how empowering, to be able to turn that energy that's often being directed externally. And you said, the stereotype of the strong Black woman and, that sense that we can do everything for everyone else. But you're saying, oh no, the strong Black woman actually needs to turn that lens back upon herself and that same love and affection and energy.
Yeah, and we need to be able to be okay with letting that go and letting that stereotype lay where it needs to, because there's actually a curse many times and stops us from seeking help. And the idea, when we internalize that stereotype, it kind of sends the message to us when we need help that we're weak for wanting to do so or weak for needing to do so. And so being able to allow that stereotype to flee while I do my work and saying, you know what? This does not make me weak. Actually, this makes me powerful. This makes me an advocate for myself. And I'm unapologetically going to do my work. And I'm unapologetically going to take care of me, especially now because I'm not okay, during all that we have going on.
So brave, maybe, would that be another way of like looking at it? That's bravery to sort of create the space to do the work, or how do you frame it?
I actually will look at it as just being giving ourselves permission. To do. And because here's why I'm scared of those words, just to be honest.
No, I'm happy to hear about the language.
Yes, I feel like in this country, brave takes the expectation that you can take on more, and that you're bold, and that we just can keep packing stuff on you, and that you can just kind of keep going no matter what's on your shoulders. And while I believe that we can do those things, I think we also need the space to be able to shed a lot of those labels and just say, without permission, like without those labels, I give myself permission to take care of myself. And that's exactly what it is. I'm just taking care of myself just like everybody else is allowed to take care of themselves, without it needing to be, like the superhero mom. Like, moms get this, women get this, period, and then Black women get this a lot, double. I feel like needing to just be all things. And I think that when we take on stereotypes like brave and strong, we're sometimes overlooked for the pain that we actually do feel, and maybe sometimes not believed or invalidated when we have those experiences. Like, oh, you'll pull through. We know that. We know we'll pull through, but we just want this moment right now to be okay.
So permission to have the experiences, to do the work the same way anyone else would.